I welcome you all on behalf of Dental Surgeons Association of India. So today we are really privileged to have a very special guest, Dr. Mauricio. Although he don't need any introduction, but I would like to introduce him formally. He did his DDS from Intercontinental University, Maxico in 1994. After that, he did his MS in orthodontist from Loma Linda University in 1998. He has been an eminent speaker and good researcher. He was an ambassador of American Association of Orthodontists in Maxico in 2015. He has got a vast teaching experience and has taught in many international universities. He is an editor of various journals like Journal of Maxico Dental Association. He has also been a president of Maxico Dental Association from 2015 to 2017. He has been a member of various recognized and various reputed associations of the world. He has delivered lectures at many parts of the world. We are really privileged to have you, sir, here. And whatever I've told you is just a tip of an iceberg. He has done many things apart from that. So really privileged to have him here. Apart from that, we have Dr. Robin Malik. He is a National Secretary of Dental Surgeons Association of India with us. Apart from that, a young dentist, Dr. 𝗗𝗏 𝗏, representing the Young Dental Surgeons of India and also a National Campaign Coordinator of Dental Surgeons Association of India with us in this particular conversation. I would also like to tell you that after a discussion, we'll be having a presentation by Dr. Mauricio, and it will be a great and comprehensive presentation, and it can take out the fear of practicing dentistry in the era of COVID-19. So stay tuned with us. So we'll start our conversation with comparison of dentistry between India and Mexico. So stay tuned with the conversation. In India, we are running a campaign of Save Dentist and Save Dentistry, and we are privileged to find Dr. Mauricio. So, Dr. Mauricio, there is a lot of similarity between India and Mexico. I mean, you like spicy food, the cultural diversity is also same. We share common beliefs also. So, what is common in dentistry you might have found out with your visit in India?
Well, thank you very much, and thank you for the invitation, Dr. Tomar, Dr. Malik, and Dr. 𝗏𝗏. It's an honor for me to be here. Being a dentist, all of us, and having the specialist of orthodontics, we have to be at days with all what is happening now, not only in Mexico and in India, but all over the world. And like you mentioned, the quality of dentistry in Mexico and in India, it's very good. It's high class, high academic quality of dentistry. The other situation, although we don't have the same population, Mexico it's around 120 million people. I believe India is 1,400 million people, if I'm not wrong. So the similarities, the economy in Mexico as in India, we have a strong economy, but there is a situation that people live day by day. There is, we have strong economies, we have strong cultural countries, but the economy is difficult in both countries. And having this pandemic, of course, the lockdowns in people, they're people that are very unprivileged. So this is very hard. It's hard for the people that they are middle low class, but for the poor people, this group of people is very difficult, and of course they are more vulnerable as well to get contaminated. Having said that, having a strong population that they live in poverty, it's also good to remember that many children and many families, they don't have access to vaccines. But having this kind of population, although they are exposed to all kinds of viruses, not only the coronavirus, which is the topic that we're going to touch today, the children and the people, they create a strong immune system. Okay, this kind of people, they don't have access to get vaccines in the hospitals, public or private, but they have a strong immune system, and this is what keeps them from having any kind of disease.
Over to you, Dr. Robin Malik. You have been practicing dentistry since very long now, and you're running a campaign, Save Dentist, Save Dentistry. So what is the ground reality there in India? I mean, the condition, because the cases are rising each and every day. It was initially at a very controlled level, but the cases are rising now. So what do you think, what is the appropriate time to start with the practice? Because that we dentists are into a dilemma that when to start the practice, because as per government guidelines, they are instructing us to only start with the emergency cases.
Well, India is the second largest country as far as the number of colleges, dental colleges we have after Brazil, and we have like around almost 2.75 lakh dental surgeons in India. The coronavirus has hit very badly on our economy. Earlier we were like on the totally lockdown, the situation was very under the control, but as we relax the lockdown, the cases are rising day by day, and we are seeing exponential growth in the cases. So I think being we are a very higher risk on for the coronavirus. So I think we should wait and watch for some time, and then we should start our practice, because I think as per the guidelines also we are not allowed to do all the treatments. Only the emergency treatments are allowed. So I think it's better to wait and watch, and we can do our telemedicine and all. We can help our patient with that till that time.
Dr. Mauricio, we have been hearing a lot about aerosol these days. I mean, as per Government of India, the Supreme Court guidelines, the procedure which involve aerosols are been restricted by Government of India. So what is your take on that? Because dentistry produce a lot of aerosols. So what is your technical comment on this particular topic?
Well, for the last month, I think the World Health Organization suggested to avoid any kind of procedure in dentistry or in medicine that will release aerosol from any part of the body. And you see, we are the profession actually in number one. I would say that we are more vulnerable to get contaminated or contaminate a patient because of the closeness of the distance that we work. We actually are 10 centimeters away from the patient, and this is why the World Health Organization suggested to not do any kind of procedure that releases aerosol from any part of the surgical procedures that we're going to do, or dental procedures.
Right, sir. So we have Dr. 𝗗𝗏 Tripathi also with us. He is representing Young Dentists of India. So I would like to ask Dr. 𝗗𝗏, what are the problems these young dentists are facing these days?
I think young dentists facing lots of problem in India. Our biggest problem is our complicated guidelines provided by government. Most of clinic established in very small area, and government started guidelines for dentists for big areas, according to big areas clinic space. So I think it's a very common and biggest problem of our young dental surgeons, and we have lots of protocols. How can we follow in our small space? So I think it's our biggest problem. So that's why Indian young dentists not doing a practice till now, and waiting something positive from government's guidelines so we can start our practice. And we have lots of issues regarding our PPE and 95 mask rates and availability. So I think it's very common problems for young dentists.
Thank you, Dr. 𝗗𝗏, and I would like to go to Dr. Mauricio. We were talking about PPE kits. So since there has been mushrooming of manufacturers in India right now, they are producing kits, PPE kits like 45 GSM, 65 GSM, 85 GSM, 100 GSM. So according to you, what is the thickness, what is the best thickness of PPE kits we can use in our practice so that we can save ourselves and the patients also?
Well, we dentists have the most, I would say, highest standards and protocols of asepsis and antisepsis, starting from our gowns and our scrubs. So now, after COVID and during COVID, our dress code is going to change. Also, the materials and all the protection that we are using to avoid any contamination also is going to be stronger. And now these are going to be our standards of healthcare that we're going to give and to receive from the patients. And I will show some of this in my presentation.
Okay. Yeah, stay tuned with us. We have a very good presentation coming up with Dr. Mauricio. To this point, I would like to ask Dr. Robin, since our clinics are closed since 22nd of March and government is planning to open up the situation from 31st of May. It is something similar in Mexico also. Government is trying to open the lockdown from 1st of June, I guess, if I'm not wrong, Dr. Mauricio.
Yes, our lockdown is supposed to finish. We were on stage 4, and our lockdown it's supposed to finish on June 1st. But there was a news yesterday that it might get a little bit longer until May, 15 more days, June 15. This is what they were saying in the government. Having said that, I want to tell, before I start my presentation, that we believe that no government in the world was prepared for a situation like this. No government in the world have the number of hospitals, have the number of beds, have the number of ventilators to treat the amount of patients that got contaminated. And also non-government in the world were prepared with a medicine or a vaccine for this kind of virus. And this was the difficult situation that we are living worldwide.
Correct, sir. Dr. Robin Malik, we have been discussing about the quackery in India. So what do you want to say about that? Because a huge number of quackery is also there and they have started their practice. So we have written a letter to Government of India also regarding this condition. So what is your take on that?
Well, I think quackery is one of the most like a big problem for all of us, for the nation, for the dentistry, because they are playing with the lives of the people. In the lockdown, we are like sitting at home. We are not opening our clinics to protect our students from spreading of the coronavirus. But the quacks, without the degrees, they are practicing and they are not following any protocols and they are treating patients. So it's a very, I think it's a very risky situation for them. Like, we have to take action against them, and we have already initiated the campaign, anti-quackery campaign under our association banner, and I have already written to all the government authorities regarding that. And in soon coming days, you will see our teams on the ground level to work on it. We are not going to tolerate it anymore because it's a very, very, very risky situation for all of us. We have to fight them.
Dr. Mauricio, we have been hearing about fumigation in the clinics. So this is a new normal for dental surgeons now. I mean, we were not doing fumigation as per the previous practices. It's a new normal for us. So what are your recommendation on the fumigation in the clinics, in the dental clinics?
Well, I will treat this in my presentation, but here the Mexican FDA, that stands for COFEPRIS, the Commission for Sanitary Risk, by law we need to sanitize every 6 months and fumigate every 6 months our dental clinics or orthodontic clinics. So this is a standard that we have to have a certificate, okay, that we are fumigating and sanitizing our dental clinics. This is by law in Mexico. You have to have it, and any time that you have a revision, you have to have your certificate from the company that came to your clinic to do the fumigation and sanitation. This is a standard. By law.
We would really love to hear your presentation, Dr. Mauricio. It was a privilege to have you on this board. I mean, there were some issues from dental surgeons of India. I think Dr. Robin want to add something on this particular note. Please, Dr. Robin, go ahead.
My question is to Mauricio. Mauricio, can you tell me, like, in the Mexico, the center side of a dental clinic, how large the clinic is in Mexico? The average clinics, that are they small clinics or they are mid-range or they high or bigger clinics they are, and how the smaller clinics are coming back into practice? Because in India, what we are facing, like, because the young dental surgeons are having very small clinics within the 200 square feet area or 250 square feet area, and it's very difficult to follow all the protocols in the small area. So how you people are doing in your country?
Well, in Mexico, and I believe in India, this has to be the same. We have dental clinics that are in the garages of the houses of some doctors. They have their dental clinic in the garage, or actually they have not the garage, but another room especially to do the dental service. We have very big clinics at the floor level in the main streets. We have big clinics. We have franchises and brands of dental clinics, and also we have beautiful clinics in big buildings. Like one of my clinics is on the 12th floor. So in Mexico there are all kinds of clinics, and there are also even people that they have, in rural communities and in farms and people that they live far away from the cities. Also, there are clinics that they have to accommodate having a lot of limitations, but they will have a standard of care, a low standard of care, but they have regional public hospitals that some of them they have the dental service. So they try, of course, with people that they have their clinics in their own houses. This is difficult to have all the standards of care and all the recommendations and obligations that by law we have to follow. But the quality of dentistry, we can say in Mexico, is very good. Although, of course, there are not very good schools that they are. For example, the dental school here in Mexico has to last for 5 years, 4 years of school and 1 year for social service, and then you can open your practice. But nowadays they are opening schools that they do a 2-year or 3-year dental school. Of course, the quality, academic quality, clinical and theoretical, is not so good. And unfortunately, the government allows these kind of schools to open.
Okay.
And do you have any minimum price, treatment price list from your association for Mexico? Like the minimum price list for the treatment you do in your clinics, that you can't charge below that? Is there such standards set by the association in Mexico?
Of course, there are all kinds of prices, depending on also on the community that you open your prices, depending on the neighborhood that you open, and like I mentioned, the neighborhood, and also the buildings that you open your dental practice. There is not, of course, there is a mid average. That's an average of prices, but you can get very low prices and highest prices. Not as we cannot charge the same as countries like in the United States or Germany or France, but it's a high price for people for that they live in the privileged communities and neighborhoods.
No, but I just want to know that, is there any minimum price list, like below that you can't charge? Is there any set standards like that from your association?
No, minimum prices. I would say even there are people that they do pro bono treatments that they don't charge, and they do like welfare treatments. But minimum prices I cannot tell you, because as you know, we have all different kinds of procedures. So the minimum price I don't even know, because maybe you have a friend or you have a family member that came to your dental clinic, and of course you're not going to charge the same for like another normal patient. So the average price, there's a media of prices, but the minimum I will not be able to tell you, to let you know.
Both India and Mexico is a big destination for medical tourism as well, for that particular reason, I guess.
Exactly. Well, in Mexico we are close to the United States, and many population from the United States, they cross the border to get their dental treatments. But yes, also in India, like in Mexico, we have beautiful resorts that in Cancun, Acapulco, different places that now they are offering medical tourism, and they come down, they do their dental treatment, and also they get a little bit of vacations. Now this is the way they are managing in some countries.
And
Dr. Malik want to add on.
Yeah, and I just want to know that after the COVID-19, now we are opening your clinic, you have opened your clinic. Have you made any changes in your price list of the treatment? You are like, have you add something into your treatment cost?
Well, this is a very good question. I didn't close my clinic during COVID. I have not closed my clinic because, first of all, we have some orthodontic emergencies, and although my clinic is 90% for orthodontic treatments because it's my specialty, I have other doctors that they are general dentists, and they attend emergencies, different dental emergencies, so we have to be there. Now, of course, our dress code as the dentist has changed, but there is an important thing here. The price of the dollar, the currency exchange between the peso, which is the Mexican currency, and the dollar has risen, and many dental companies, they also rise their prices. So the dental materials went up, and of course it's difficult for us to charge more for the patient. What we are asking, and there has been a kind of a little bit of advertisement, that dentists are getting together to ask for the dental commercial companies, to all the dental branches, that they don't rise the prices of our dental materials higher than the currency exchange. Like, just to give you an example, if $1 was, for example, 20 pesos, and now, well, it was 18 pesos, and now it went all the way up to 23, 24 pesos. We are asking, because as you know, many of our materials are made in the USA or in foreign countries, but some dental companies, they rise the prices higher than the currency exchange, like maybe instead of 15 to 20%, they have risen the prices up to 30 or 40%. So we are asking the dental companies not to do this, because it's and even you are going to see how we have to get more asepsis barriers, more barriers in our offices, and this is going to be more expensive also for us. Our profession, it's very expensive because all that we use is disposable. Even the burrs, even the pliers, all the materials, we have to renew all the time. We have to renew all our materials. Even a dental chair has a lifetime of a working lifetime. So we have to make a really consideration and open the minds of the people that they sell dental products to help us in this. I think all the professions have been damaged, and they have been hurt, economically speaking, by the coronavirus. But of all the professions, our profession is the one that it's going to be more hurt, if you want to call it like this.
Are the dental surgeons now working in medical wards? They are treating, or they are segregating the COVID patients? Are the government is asking them to support them in this particular crisis situation in Mexico?
Well, no, we have not get to the point that we have to lend our clinics to treat COVID patients. But what I want to do really here, it's very important what I'm going to say right now. I think that it's easier that a normal people gets contaminated while going to the supermarket or while getting gasoline than getting contaminated in a dental office. Why? Because our protocols of asepsis and antisepsis are the highest ones. And I could say that it's easier that a patient from COVID contaminate us than we as dentists contaminate the patient. Why? Because you're going to see in my presentation, now we have roles and also our levels of protocols and dental barriers, you see, to avoid any kind of contamination. Of course, I'm going to tell you one thing. When I graduated from dental school back in 1994, and from 1990 to 1994, 1995, we were taught, remember, to treat a patient like if all our patients were HIV positive. Remember this. So now we are going to treat our patients like if all of them, they were COVID positives. Okay, like if all of them, they were contaminated. So our community, and this your association and our associations have to work on, is to go out there and do a lot of publications and marketing, telling the people that it's safe to go to the dentist. Okay, it's very safe to go to the dentist, that they can keep on going with their dental treatment without any situation. Of course, the people that are vulnerable and that they have already a systemic disease, or the ones that they are afraid that their immune system is not very good. Of course, these kind of people, they have to be very careful and maybe during a period of time avoid going to the dentist. But any normal people with a healthy situation, they can have no problems and no fear on attending to the dental practices.
Since the new protocols are there, they are very stringent. So would you recommend to go for mock drills before actually doing the patient? Because our dentists in India are sitting at home since like 60 days. So I mean, learning the new things will be a little difficult. So mock drills, is it necessary?
Again, I'm sorry, I didn't get the question. The communication cut a little bit.
I'm talking about the mock drills. Mock drills means you have to practice and re-practice, since these things are very much new to us. And in India, we are in lockdown from last 60 days. We haven't opened our clinic. So I want to recommend that you recommend mock drills to be done to get used to the new normal things in the clinics.
If you have not opened your clinics, I mean, you have not lost the practice. What you learn very well in dental school and during your clinical experience, you can apply it in any kind of patient. So correct. Don't be afraid of going back. Don't be afraid of taking the handpiece. Of course, you have to be very careful with the aerosols. And now the only thing is that depending on the economy of each dentist is what you are willing to invest in the protection for you, for your assistants, and for the patient, even for your clinic. Now we are going to invest more, you know, because as always, we have a sterilization machine, we have a nice dental chair, we have nice hand pieces, we have nice pliers. Depending on the brand, we have good instruments. But also now we are going to invest a lot in disposable materials, disposable gowns, disposable, like you know, maybe 50% what we use in the dental clinic is disposable. Now we are going to have to invest even more, and the sanitization and fumigation of our clinics.
Shall we go ahead with the presentation, Dr. Robin?
Yeah, I think it's good. We can proceed with the presentation.
Data that I'm going to share with you is based 90% on the World Health Organization documents that they have exposed worldwide, and all the information about the COVID-19, and also some information of the American Dental Association. So any kind of information that you would like to add to this, you can go ahead and into the website of the World Health Organization. Like I mentioned you before, I'm not an infectologist, I'm not an epidemiologist. I am only a dentist with a specialty and master's degree in orthodontics. So what I'm going to share with you is some of the standards and protocols that we are using, and I'm going to give a little bit introduction of what is the COVID. Well, the COVID virus, COVID-19, it can be called, and also the SARS-CoV-2 or the coronavirus. These are the three names that they are using worldwide, and this is a picture of the virus. Now, one very important thing is that people can diagnose or can know the signs and symptoms of a COVID. And here is just a small table. Just I'm going to share it very quickly with you to show the difference of an illness like a common cold, a high fever, like a pollen allergy, and the COVID-19. So talking about fever on a common cold, the first data I will give you of a common cold, and the second data I'm going to give you of the COVID-19. Talking about the fever, the number of in degrees Celsius usually is higher than 38.5. On a COVID, it will be higher than 38.5. It could be all over 39 up to 40 degrees of fever. Cough, sometimes on a common cold, and the cough is persistent and it's a very dry cough. And also the patients report a sore throat, very sore throat. Runny nose, yes, on a common cold. On the COVID, sometimes. Sneezing, yes, and COVID, sometimes. Headaches, yes, and a COVID, it's a strong headache. It's a very strong headache. Myalgia, which is pain in the muscles, during a common cold, no. And on a COVID, the patient reports a high pain on the muscles. Anosmia, which is the loss of smell, sometimes is in the cold. And during the COVID also, most of 50% of the patients, they report a loss of the smell. Conjunctivitis, sometimes depending on the virus, on a common cold, and on the COVID, yes. Skin rash, no and no. Fatigue sometimes, and on the COVID, the patient feels really, really bad and with a strong fatigue. Difficult breathing in the common cold, no. And in the COVID, depending of the severe and moderate cases, some people they report that they cannot breathe, and when it's a very severe case, you have to start using the ventilators. Of course, the patients have to be hospitalized. And relief by antihistamines. The antihistamines are included in the OTC cold medications, and they will relieve on a common cold the pain, but on the COVID-19 they will not relieve the pain. Okay, now this is a photograph and a video of the actual COVID virus, and it explains on this graphic how it goes through the nose or the mouth to the lungs, and then it starts with the infection of the lungs. Okay, so this is just a graphic to show how the COVID gets into the body and how it gets into the alveolus of the lungs. Now, which is the most vulnerable population? Well, anyone can get and pass or contaminate the virus, but most of the people will have no symptoms, or in any case will have it very mild. About 80% of the people that they get contaminated. Now, the problem population and the most vulnerable to have a strong disease is the people with prevalent systemic or chronic conditions like heart diseases, breathing problems, diabetics, hypertension, and also the overweighted people. Most likely they will have severe symptoms. Smokers also, and elderly people, over 60 people, this population have to be very, very careful with this. And of course, in this slide, these people are the ones that they have to stay in lockdown. These people are the really ones that they have to be careful on not going out and keep their quarantine. The people that have a normal, healthy situation and the ones that they believe to have a strong immune system, these are the ones that they can go out and also taking care with their mask and everything. So around the world, they are killing the 2% of the people who catch it, are the ones that are dying of COVID. Now in Mexico, this percentage is a little bit higher. It's almost close to 4%, okay? Now, the World Health Organization talks about social distance. And what is social distance? Social distancing, it's also called physical distancing, which means keeping space between yourself and other people outside of your home to practice social or physical distance. You have to stay at least 6 feet, up to 2 meters from other people. Do not gather in groups, okay? And stay out of crowded places and avoid mass gatherings. This is what social distance stands for. So now, talking about the COVID, it's a heavy virus, okay? And what they mention is that when you cough or people cough or sneeze, the exhalation goes all the way up to 1.5 meters at the most. It's less than 2 meters. So in other kind of viruses, the droplets can go up to 6 meters, okay? Now, this is also why they mention you have to be careful with the soles of the shoes or the tennis, because this virus, like I mentioned, is heavy, and you also have to sanitize your shoes. Now, this is just a small graphic that we got from a website, and here, as you can see, in the United States, they already have recovered 1,622,000. Almost to 23,000 people, and they are close to 100 deaths in the United States. Now, talking about India, for what they report, 131,868 people have recovered, and only 3,867 people have died. This is for May 24. Okay. Now, I am very surprised about India, and I want to congratulate you, because here in Mexico, these numbers are higher. Okay, in Mexico, we are up to almost 10,000 deaths. You cannot see here on the graphic, but we have recovered 65,000, almost 67,000. So I want to let you know that maybe we are not seeing the official numbers in all countries, because maybe the governments are afraid to create panic in the people. But I think this is my own personal and very subjective thinking, that not all the governments are reporting their official and real numbers of dead people, recovered people, and contaminated people. Now, talking about the lockdowns, like I mentioned, people with systemic problems or with a very weak immune system, they have to stay in lockdown 100% of the time. And people, the ones that they are healthy and with a strong immune system, they can go out. Now, like I mentioned, in India and in Mexico, it's very common economical situation, because we have people that, economically speaking, they live day by day and they have to go out to eat. So some people, they don't mind to risk, because either they will die of coronavirus or they will die of starvation. They will die of starvation. Now, it's not that when you have a lockdown, the virus is going to be outside. You can have the virus even inside your house. And this is why you have to, this is just a small video, just a little bit of funny things. But being very serious, is not that if you have a lockdown, the virus will stay outside. You can have the virus inside your house, but it's also good, just like we fumigate and sanitize our clinic, it's good that you also hire these people to fumigate and sanitize your houses. Okay, let me go to the next slide. Like I mentioned sanitization, fumigation, and UV lamps are the protocols of asepsis and antisepsis that in Mexico we have to have by law. The Mexican FDA, it's called COFEPRIS, and every 6 months we need to fumigate, sanitize, and also have some kind of sterilization in our clinics. Here you're seeing in some photographs UV lamps that also serves to sterilize the rooms, the lab, for example. But we need to hire companies that come specifically every 6 months to the dental clinic and sanitize and fumigate. And of course, we have to show this certification if we have any revision from the government to have all the standards of care. Now, what are we doing? And with these photographs is what are we doing in our clinics since the patient comes from the elevator? So when before the patient, because I'm in a 12th floor, before the patient comes into my clinic, we have this that the patient has to clean their feet, their soles there, and with this, it's like artificial grass. Um, and the patient has to clean their feet before entering into the elevator. Now, when the patient comes into the clinic, and this is a photo from a friend of mine, Enrique Cruz from the United States, and we do the same, you can have two things. Either take the temperature of the patient, and if you don't have these mats, okay, the one that I was telling you, you can have this machine. It's an expensive machine, but what it does, it protects your shoes so that you can go inside the clinic. Of course, as a standard of care, we need to have the patient with a mask during while they are getting into the clinic, and when they sit, they will remove the mask so that we can start our procedure. Okay, and of course we have to have hand sanitizer in the waiting room, and these things are the standards for our clinic to start treating the patient. Now, what does the ADA, the American Dental Association, is telling us about and giving us information about the aerosols? The ADA mentions that the dental aerosols can spread up to 11 millimeters, and they can persist in the clinic for 30 minutes up to 2 hours. So now what we are recommending is, although you have sanitized your clinic, you have to do cleaning of all the surfaces before and after the day, okay? And also you have to clean the dental chair. You have all the barriers. You have to have your tapes in all the hand pieces. You have to have the tapes in the light of the dental chair. And this is a slide from the Wuhan city dentist during routinely. This is what we used to do on the left side as dentists. Now our dress codes during the outbreak have changed. And what mention about this? Well, we used to have in the left side all the regular scrubs. Now, after the scrubs, we have to have this full surgical disposable gown that we can use, or it can be also sterilizable. Okay, you can sterilize these kind of gowns. They are repellent to fluids. And also on the upper right side, you have also these kind of gowns that we can use for the patients. Can we use only the scrubs? Yes, this depends on how much you want to invest in the protection and in your clinic. Right now, is by law, we cannot, it's not that we are using these sterilizable surgical gowns, but if you want, you can use them, even that you sanitize and everything. Again, it depends how much you want to invest in the protection and the care of the patient. Now, we have this different kind of mask. I am not a speaker for 3M and I don't get any royalties, but for what we heard, the KN95 3M mask is the best. We can use them up to 8 hours, and this is what they are using in the hospitals. Of course, there are stronger protection of masks, like the ones you see in the middle with these filters. Eye protection is very important because, like I mentioned you, the aerosols and the virus can go through the eyes, the nose, and the mouth. So the protection glasses are very important. You want to have and you want to invest more in your protection. These are all different kind of masks. The ones on the left, this is a standard of care now, but these are on the three on the right. These are all different kind of masks that they will cover mostly all of your face. Of course, you have to have on your head the cap, protection and surgical cap, of course, when you're doing any kind of surgical procedure. And these are other kind of masks, again, depending on how much money you want to invest. Now, dental aerosols, again, this is the virus, the actual photograph of the virus. And this could be spread when we are working on the patient. So this is why the World Health Organization is suggesting to not do any kind of aerosol procedures and just attend emergencies. You have to make all the people to make them understand that it's safe to come to the dentist. It's very safe to come to the dentist, and they have they will have no fear of getting contaminated. Now, these tips are suction tips for aerosols, and you can buy them or print them on a 3D printer. And these are two different types of aerosol suction tips. And this is with cheek retractors. They will work very nice. When you are going to do any kind of aerosol releasing a procedure, you can use these suction tips, okay?
Okay.
Now, to also protect from aerosol procedures, all these photographs, some of them I get them from some dental friends, and some I get them from Facebook or some websites, just to show how some dentists are protecting and keeping the barriers. You can do this with this kind of paper that is used in the kitchen for food, this plastic, or you can have an acrylic protection or a glass protection to protect you from the aerosols. And of course, again, some of these devices are almost having a patient with a bubble, and also this plastic protector. You see only the dentist is working with the hands, and it's protecting from getting all the aerosols releasing, okay? Now, again, if you can invest, you can see how we have all the barriers. Here they are doing a root canal, but you can see the vacuum of to get all the aerosol that is releasing from the patient. These are vacuum machines specific for dental chairs. So again, depending, like you asked me, Robin, what was the prices of the dental procedures? Well, depending on how much you invest and depending on how much you want to raise your prices, okay, this is the standard of care that you want to give to your patient. You can give the highest standard of care, although if you don't want to invest in this, I already show you how can you protect yourself. Now, what happens when you go back home? Well, when you go back home, you have to do exactly the same. If before getting home, you are dressed in your gowns, and you clean your feet in these mats, okay? And I'm going to show you a small video of how a person gets home. So here you have all the gel in the door, and here you after you clean your feet, again you clean them at home. You can have the mats inside home, and of course have the hand sanitizer. At my house, I have some stericyde spray that I can spray it in my face. I take off my clothes and I put them on a plastic bag, and then I throw them to the washing machine, okay? And you can have also any brand of the surface disinfection. I actually spray myself with these aerosols. You know, just you have to be careful with your family, and even that when you are on a lockdown, the virus can be inside your house, no? Now, I want to talk about the immune system. Why I mention a lot the immune system? Our immune system saves us from death by infection, and any human born with a defective immune system will soon die unless isolated from exposure to infections, agents like bacterial, viral, fungal, or parasitic. These are patients that have to be on quarantine the rest of their lives. There's even a movie in the USA with John Travolta that there was a child that he lived in a bubble because his immune system was none, and they had to protect him from any kind of, again, bacterial, viral, fungal, or parasitic infection. The cells like macrophages and neutrophils also play an important role in defending us against infection, but they are only one part of a much more complex and sophisticated defense of our immune system. Now, like Darwin said, and for me this is the best, and I'm going to quote Darwin, this is the best quote: "It's not the strongest of the species that survives, not the most intelligent. It is the one that is the most adaptable to change." Charles Darwin. And if your immune system can adapt to this virus and you have a strong immune system, then you will have, not that I'm going to say no worries, but we are exposed not only to COVID virus, we are exposed to so many viruses around our life. And this is where I want to say Mexico is very similar to India, because we have many people that they live on the streets, and all these people and children that they live on the streets, they don't have any access to hospitals or access to vaccines, but they have their own immune system. And this is what some of them, they can live in the streets with all the exposure to any kind of viruses, and they can survive. So what I want to say here, it's there is no vaccine to coronavirus still. There is not an official treatment for coronavirus, but it's better to prevent the disease than to cure it. When you have where are you going to have a strong immune system? Of course, is that we get a strong immune system from foods, and also when we expose to the sun, when we get a suntan, our body releases vitamin D. So these are some of the foods that we can get, and they are called immune system boost. And this is why I put this slide: keep calm and boost your immune system. So zinc, you can get it from lean meats, seafood, milk, whole grains, beans, seeds, and nuts. Vitamin C, you can get from broccoli, cantaloupe, kale, oranges, strawberries, tomatoes, guava, and lychee. Vitamin E, nuts, seeds, wheat, germ, green leafy vegetables, avocado, and shrimps. Iron, lentils, spinach, tofu, and white beans. Vitamin A, sweet potatoes, carrots, red bell pepper, spinach, black-eyed peas, and mangoes. Vitamin B6, green vegetables, chickpeas, cold water fish such as tuna or salmon. Now, of course, low class, middle class people, sometimes they cannot get all these kind of products, but in countries like India and Mexico, depending on where you buy it, you can have supermarkets or you can have street markets, and you can get this kind of food as for a reasonable price. Okay. Now, this slide I want to share it is from the Journal of the American Medical Association, and this is one personal and I want to share this information with you. Some people that they have lung cancer. This is a study among 210,509 people. They get autoimmune disease. People with lung cancer. So. People with lung cancer can suffer of rheumatoid arthritis. This is a 4.5% prevalence. Psoriasis, 2.8. Polymyalgia rheumatic, 1.8. Addison disease, 1.0. Systemic lupus erythematosus, 0.9. Ulcerative colitis, 0.8. Giant cell arthritis, 0.8. Zika syndrome, 0.6. Regional enteritis, 0.5. Meniere's disease, it's unspecified, 0.5. So it's a prevalence of 13.5 that they might get an autoimmune disease. So people with lung cancer, of course, they cannot go out. They have to stay in lockdown. They have to stay in quarantine because they would be very vulnerable population to get the COVID. And if they get, of course, they will get a severe expression of the disease. Now, again, there is not an official treatment for COVID, but this is what is working in some countries, and of course, this is what is working in some population. Okay, and the combination of the hydroxychloroquine with azithromycin, which is a strong antibiotic, has worked in some population of the United States, and also has worked in some other countries and some other populations. But why is not official? Again, because the treatment, it doesn't cures 100% of the people that is getting this treatment. But it's also a recommendation. It was a strong combination in the United States. But this combination, you have to be very careful and don't prescribe this combination in patients with rheumatoid arthritis. Okay, this is a no-no for patients with rheumatoid arthritis. Now, talking about very specific in Mexico, and this is what I am very proud of, the Mexican Institute of Social Security, which is the Instituto Mexicano del Seguro Social, has found a treatment that it's already approved by the Mexican FDA, which is the 𝗗𝗏, and they are injecting the plasma of the recovered patients to the patients that are under COVID treatment. Okay, what is this? Patients who recovered from COVID-19, they are donating their blood, and from their blood, they are taking the plasma, and this plasma, they are injecting it into the patients that are suffering, and they have a moderate to severe conditions, and people are recovering. So Dr. 𝗗𝗵𝗔𝗜 from the Hematopoietic Stem Cells Bank of the Central Blood Bank of the National Medical Center in Mexico explained that this protocol collects plasma from patients who have recovered from COVID-19 or SARS-CoV-2 because this blood component contains a high significant load of antibodies. This, like I mentioned you can get into the website of the Instituto Mexicano del Seguro Social. You can get a translation, and you can see how this treatment is working. Again, it's not worldwide, but it's what we are using in the public hospitals of Mexico. Now, what is going to be the new worldwide flag? Of course, people, even that you have a strong immune system or a weak immune system, you have to go out with your mask. And this is going to be a standard. And when we go to public places, I don't think, I think at the least of this year, at least up to December of this year, and maybe the beginning of the next year, we are going to use masks to go out to the street. And some people are even going out with gloves and with glasses. So this is the new worldwide flag. And now, just to finish, we have to learn from history, and for what we have seen is every 100 years there is some kind of pandemic in the world. In 1720 it was a plague, in 1820 it was the cholera, in 1920 it was the Spanish flu, and in 2020 we have the coronavirus. So we have to be prepared with hospitals, we have to be prepared with beds, and we have to be prepared depending on the number of population that we have in the countries. They have to be prepared. Just to let you know, the hydroxychloroquine, this treatment was given to people with autoimmune problems like lupus erythematosus, and also in Africa. The hydroxychloroquine they were giving to people with Ebola. Okay, so just to finish, we see with this coronavirus how vulnerable we are for this kind of diseases. And the message today, and I'm going to be very philosophical, is that we don't have to be selfish and only think about our families and our countries. We have to think about all the world. We live in this world. I don't think there's going to be enough research to go to live to another planet. So I think this shook us all just to make us with more sensitive and more sensible to protect our world, to protect our bodies, and to think as a whole nation, one world, one nation. We need to protect all of us, and we need to take care of all of us. I think this is the way to think. And if you think about it, seeing the planet, the Earth, from the space, you don't see any borders, okay? It's only one circle with land and water. So I think we're going to prevail. All the data that I gather again is from the ADA and from the World Health Organization, and I took some photographs from internet and from Facebook, and I think we can do it. We need to also learn that the doctors and medical people, and we dentists and health providers, people have to give us the right value to our profession. Okay, they have to value our profession, and sometimes it's weird how a soccer player or a football player make millions and millions of dollars, and sometimes people they complain of what dental procedure or any medical procedure is done. With this, I finish my presentation. I hope that it was good information for you and for all your colleagues. And I want to motivate all the dentists in India and all the dentists around the world to promote our profession and to tell people, to educate people that it's safe to go to the dentist. And we have the highest protocols as doctors to give any kind of health care or dental care. Thank you very much. I would like to thank the Dental Surgeons Association of India for inviting me to share this information with you. This information is available for you in the World Health Organization website. And thank you very much to all my colleagues of India.
It was a very nice and comprehensive presentation. You covered most important part that the people are fearing about the fear of resuming the practice in India. I mean, this will give a lot of strength to them, and saving the environment is the most important thing that you have told in the end. And to this particular thing, I would ask if anybody wants to ask question, they can write into the comment section. And if Dr. Robin want to ask any question or Dr. Akhilesh want to ask any question, they can go ahead.
No, I think we are done with it. It's a very good presentation. Thank you, Dr. Mauricio. It was wonderful to have you with us.
Thank you, Dr.
Thank you very much. Well, thank you very much, guys.
Okay, bye-bye.
Thank you, doctor. Take care.
Namaste from India.
Namaste from India.
Take care. Namaste.
Yeah.
Bye-bye. Thank you.
Bye-bye.
Bye.
Take care.